All right. I think we should move on to data integrity. This is actually kind of a long section with a couple of subsections. So, Priya, do you want to talk about investigators and data?
Yes, thank you, Denise. So another interesting part. So here, the first requirement here has to do with the investigators and data. GCP now says that sponsors should ensure that access permissions granted to investigators site staff align with delegated responsibilities and are visible to the inspector. Also, sponsors are required to make sure that investigators have timely access to data, not just the EDC data, but all relevant data from external sources, unless the data would be unblinding. The other requirement here, the third requirement, is really talking about where sponsors are to seek investigator endorsement. For example, an endorsement would be when the investigator e-sign casebooks. But as with the point above, so, thinking about that, then this should also apply to all relevant data. And then finally, the final bullet point here is talking about when the sponsor should ensure that investigators have access to the required data for retention purposes.
Thanks, Priya. So we've got a couple of potential challenges here. The first is kind of minor, but E6 says that we have to ensure that investigators have visibility into site staff roles and permissions in data capture systems. Usually, a person's role is visible to the person logging in, but we don't really have a mechanism for informing the investigator of the roles and permissions of their individual site staff. So we might need to think about how we are going to communicate that to make sure that the investigator is aware of which permissions are attached to certain roles and which roles their site staff are assigned. And we could probably cobble that together from the bits of information that we send to the investigators now, the manual for the EDC system, the ECR, the ECCGs, the user list, right? But a bigger issue, much bigger issue, is the proliferation of external data in clinical trials. So as Priya just said, we tend to think of data as, clinical data as the EDC system, and that is what we would call the clinical database. But we might need to assess other data streams, central lab data, specialty lab data, IRT data, ePro data, and determine what investigators need to access in order to evaluate safety and efficacy and eligibility, and also how they're going to access it, and then how they are going to endorse it if we think that that is necessary and retain it. So we're used to PIs endorsing ECRFs. They have an e-signature, and sometimes they endorse lab reports individually, right, when they sign off on them. But we don't always have them endorse like ePro data or IRT data. And sometimes sponsors address this by integrating their data with the EDC data so that the investigators are signing off on all of it at once. But not always. So we need to think about that. And a lot of times these other data streams are not provided to the sites. They're not, we don't send them, IRT data like we would send ECRF data. So we need to increasingly think about the whole data flow of our studies. Okay. So part 2 of this is data changes, and Priya is going to talk about this.
Yeah, thank you, Denise. So we've talked about investigators and data. Now, with data changes, I think none of this is going to be a surprise, but maybe from the angle that it's really detailed, right? These requirements here. So, firstly, it talks about sponsors, not making changes, that sponsors should not make any changes to data entered by the investigator or trial participants unless it's justified and agreed upon in advance by the investigator and documented. Okay, so there you go. That's one, big requirement there. Also, the sponsor should allow correction of errors, including data entered by participants where requested by the investigators or participants. So this must be supported by source records around the time of the original entry. The next one here talks about data changes. So after unblinding, any data changes should be clearly documented, justified, authorized by the investigator, and reflected in an audit trail and reported in the CSR, and can only occur in exceptional circumstances. So this shouldn't be a habit formed and really shouldn't be even part of a process really because it's exceptional circumstances. And then finally, you'll see there the piece around the sponsor should not have exclusive control of data captured in data acquisition tools to prevent undetectable changes. And I think, Denise, I'm quite passionate about what's challenging here, but I'll let you go first with the next slide and I might have things to add there.
Okay, great. Yeah, so I just want to point out that Juan had asked what the reference is, and this is the reference for that statement about the sponsor not having exclusive control. So,
Yes.
um, having the sponsor change data has always been kind of tricky, right? But now we have something that says that investigators have to agree on changes in advance. So, what counts as advanced agreement? Are we going to use a self-evident change model like we used to have when we were entering data into our own databases, where we would have the investigators agree to categories of changes in advance, and then the data entry team could like correct a date if it was evident that, the month and year were mixed up or something like that? Or are regulators going to expect us to have documented investigator agreement for each individual change before it is made? And I'm thinking particularly of IRT systems because a lot of IRT vendors have processes where the sites can call in to the help desk and say, oh, the system won't let me change X, Y, or Z because it's too late, but I need to change it. And then the help desk makes that change. So those changes tend to be documented in help desk tickets, which are not part of the data and they're not even part of the TMF. So if we have processes like this, we need to think about how they're going to be documented. Priya was also reminding me that we see lots of this documentation in notes to file and even in emails. And we really, need to think about that. Like, how are we going to have a complete listing of who agreed to what changes? Now, when we think about that requirement that Priya had mentioned about um, sites and participants being able to change data, we need to think about how our eCOA and ePro systems are designed. Many of them do not let participants or sites make changes after a form is submitted or after a certain period of time. And so if we are permitting sites and patients to make justified changes, we need to think about the mechanisms for doing this. Um, Another thing I want to point out is regarding back end changes. When a data management group is making changes on the back end, either via the data capture system or in the underlying data set, we need to think about how these changes are being represented in the audit trail. We've seen some EDC systems that capture changes made by data management in a really unusual way, like it's attributed to system or it's really cryptically represented. And so one of the things you need to do when you're evaluating your data capture systems is look at how they capture these sort of changes in the audit trail. Our data management plans are going to need to be a lot more specific about this moving forward. And then the last thing I want to talk about here is sponsor control of data. So that's a hard concept. Basically, the way I read it is the site should be able to have eyes on their data at all times, so that if the sponsor decided to falsify data in some way, the site would at least have the opportunity to see it. So, for example, if we cut off read access to an EDC system for the sites, and then the sponsor, keeps it offline for a month, and then the sponsor produces E6R3 representations and sends them to the site. In theory, the sponsor could have changed the database while it was offline, or they could have changed the PDFs, right? Because they have exclusive control of the data in that scenario. So, we have a couple of different ways we could get around this. We can have give sites continuous access to their data, and then EMA has said in the past in inspections that I've been a part of that we should be having a third party produce those ECRFs, or we can have the sites download them directly. So this is something that FDA does not seem to be concerned about at all from what I've seen, but EMA is very concerned about it. And personally, I've been encountering this for at least, at 10 years now. So they've included in their Q&A. So Priya, anything else to say here before we move on and talk about audit trails?
Well, I think we'll move on, Denise, because it kind of ties to this piece, right? We were talking about note to files, and it's such a normal way to document things, but having audit trails in your systems becomes even more important now, using that feature in your systems to make sure there's an audit trail when data has been changed. And here, this requirement really, emphasizes that with these two pieces around system owner, right? So the system owner should have procedures for implementing, evaluating, assessing, managing, and reviewing relevant metadata associated with critical data. Companies struggle with this. Who's the system owner of that system? Who's the system owner of this system? So this requirement is really going to make people think around, not only the system owner piece, but around, metadata, so that you can get a good audit trail. And then the second requirement here is around procedures for planned risk-based review of trial-specific audit trails. These should always be in place. So, these two requirements in themselves really underpin everything we've said above around data. And I think, Denise, you're going to talk about what's challenging here.
Absolutely. So the concept of audit trail review is pretty common in GLP and GMP, but it's fairly new to GCP. And I should have had a poll question about who is doing this already. Teams I work with tend to say like, okay, our audit trail is huge. It's 10,000 pages. We validated our system. What am I reviewing it for? And so one of the things that is a challenge is we need to help our study teams define the purpose and methodology for audit trail reviews. For example, we should be making sure that CRAs are reviewing the audit trail when they're SDVing data to see why original data entries were changed and by whom as part of the whole picture, to make sure that authorized users are making changes and that they're appropriately delegated. And, most CRAs do this, but it might not be mentioned in your monitoring plan, and maybe not all of them are doing it. We also need to review user access audit trails to verify that principal investigators are being given access to an IRT system before the study started, or to verify that write access was removed at database lock. We might be looking through the audit trail for changes to data so that we can make sure that somebody wasn't inappropriately given a permission to make changes, so that doesn't stick out when we're looking at that audit trail. We might also look at the timing of SDV activities when we're doing on-site monitoring to make sure that they coincided with site monitoring visits. You can be sure that your inspectors are going to be doing that. So we want to do that before they do it and just make sure that there's nothing, out of the ordinary there. We might be looking for verification of post-lock changes, for verification of back-end changes. And if we are migrating systems, for example, TMFs, we might want to see what that looks like in the audit trail as well. So some possible inspection questions here.
Yes, indeed, Denise. I won't go through all of these, but people can guess, right, the questions that are going to come up. It's going to be around permissions, access. What is the sponsor's process for ensuring access to data in the event of site closure? What controls were in place to show that data were not under the sponsor's exclusive control, right? So this is going to be around those areas. Yeah.
Thanks. And then, here's an example of a storyboard, what controls were in place to show that data in the EDC system were not under the sponsor's exclusive control. So this is how you might explain it by referring to your DMP for the study specific procedures, by referring to your SOP to show, that your EDC system and your other systems are being, left open until the ECRF representations are communicated to your sites.